Hi. So what we're going to talk about next is Module 2, which is Part C and other Medicare health plans. And Part C, remember, is Medicare Advantage. So what we're going to cover is Part C, the Medicare Advantage plans, the premiums and benefits. You know, what's the advantage of having a Medicare Advantage plan? What are the different types of Medicare Advantage plans, including private fee-for-service, Medicare savings accounts. We'll talk about employer union plans. Who's eligible? How do you know that you qualify for a Medicare Advantage plan? Dual eligible plans. How Medicare Advantage plans work with prescription drugs. We'll talk a little bit about cost plans, and then we'll get in more enrollee protections. I know that we briefly talked about them in the first module, but we'll go into all of this in a little bit more detail. So Medicare Advantage plan, again, that's considered Part C. It's offered by private insurance companies. I mean, United Healthcare and Excelis and Aetna, Humana, they all have Medicare Advantage plans. It's going to cover everything that's in Part A and Part B of Medicare. It's going to have drug coverage included. There are some Medicare Advantage plans that actually don't have drug coverage included. Tends to be for people that maybe are getting their drugs through the VA, but most Medicare Advantage plans that we sell do have drug coverage included. There's going to be a maximum out of pocket. Now, with just original Medicare A and B, there is no maximum out of pocket limit, which is kind of scary. So, you know, that 20% that someone would potentially be responsible for can add up pretty quickly. But with a Medicare Advantage plan, someone's going to know, you know, worst case scenario, how much they could potentially have to pay in a given year. And there's additional benefits. I mentioned last module that in Medicare A and B, there's no dental, vision, and hearing, and those are really important benefits for a lot of people. But a Medicare Advantage is going to have those benefits. And then the types of Medicare Advantage plans, HMOs, PPOs, private fee-for-service, and medical savings account. There are some zero premium Medicare Advantage plans. In fact, there's a good amount of zero premium Medicare Advantage plans, but you know, many of them do have premiums. So the beneficiary, the person that has Medicare, would be probably, I mean, they could have an employer pay it for them, but chances are they're going to be paying themselves for Part B, and then they'll pay for whatever premium is attached to their Medicare Advantage plan. So with a Medicare Advantage plan, there's going to be deductibles, copay, coinsurance. Deductible tends to be for drugs, the higher tier drugs, 3, 4, and 5. There are some health plans out there that have deductibles for health benefits, but there's not too many. It's usually just for drugs at the higher tiers. Copays. So a fixed dollar amount per service. So, you know, say $10 copay for a visit to primary care physician. And then coinsurance would be a percentage, can be for out-of-network coverage. There could be a coinsurance. And then again, that maximum out of pocket, which I think is a huge benefit because somebody will know worst case scenario in a given year. Now, and that usually does not include drugs. So there's a maximum out of pocket, let's say it's $7,000. Drug costs do not go towards the maximum out of pocket. It's healthcare costs. Okay, so benefits of a Medicare Advantage plan. It's going to cover everything that's in Part A and Part B. And then again, it's going to have those additional benefits. There can be additional days of hospitalization, some additional benefit for skilled nursing or rehab, dental, vision, hearing, annual physical exams, fall prevention devices, over-the-counter drugs, there could be a benefit for that. And then worldwide, urgently needed and emergency services. There are also some Medicare Advantage plans that are specific to chronic health conditions. So it could be, one that's geared towards people that have diabetes or heart failure. And it's just going to be geared towards people with those conditions. Those aren't things that we are able to sell. We're going to talk about that in a bit. So utilization management with a Medicare Advantage plan. There are things such as referrals. There are certain plans where if you're going to your primary care physician, you want to go to a specialist, you may need a referral, or prior authorization might be needed. Step therapy with prescription drugs. And that is when the plan requires that you try less expensive options before trying the drug that costs more. Now, I've seen situations where a doctor will say to someone, yeah, that other drug's not going to work for you. They would let the provider, the insurance company, know that, this is the drug that you have to take. And then, potentially you wouldn't have to deal with step therapy, but that's what that is. So the different type of coordinated care plans in a Medicare Advantage, an HMO. So when I first started learning about this, I had no idea what the difference was between an HMO, a PPO, an HMO-POS. But basically with an HMO, the person has to go to an in-network doctor. If they go to a doctor that is out of network, they're going to be responsible for the full cost. Part of the process of determining what plans, Medicare Advantage plans, would be good options for someone is looking at their doctor list and seeing are all of their doctors in network for this specific plan that we're looking at. And that's true no matter if they're looking for an HMO or a PPO, any plan like that. But you want to make sure that someone's doctors are in network, especially for an HMO. Emergency services are going to be covered, no matter what plan someone has. There's an emergency, you're not going to stop and think about, is this hospital in network? You're going to go to the closest emergency room. And then the same with urgent care. You're going to go to the closest and not worry. There's a benefit for that. And again, some people are totally comfortable with HMOs. Some people don't want anything to do with them. So it really depends on someone's comfort level. Now, this mentions at the bottom here, maximum limit on out-of-pocket costs. In 2021, it was $75.50. And actually, I was looking at, from what I could see, that has not changed in 2022. For in-network, which would be the HMO, the maximum out-of-pocket is $7,550. Again, there's a lot of plans that have lower limits than that. If someone has an HMO, they might need to select a primary care doctor. They may need a referral to go to a specialist. If there is a specialist that someone needs to see and there isn't one in the network, the plan will arrange for care outside the network. Now, this HMO-POS, that POS part gives the person an out-of-network benefit. Okay, it's not a straight HMO. That POS part at the end does give an out-of-network benefit. Okay. Again, you just want to make sure that people understand that they really, no matter what plan they're on, they're going to save money if they go to an in-network doctor, in-network facility. So PPOs, with a PPO, there is an out-of-network benefit. Someone can go to any provider that accepts Medicare. You don't necessarily need a referral. But again, like I've said, you're going to pay more if someone sees an out-of-network provider. These are the figures, maximum out-of-pocket in 2021. Now, there are some regional PPOs. I know United Healthcare has some, and they are PPOs that serve an entire region, one or more states. And the ones that I've seen with United Healthcare are for the state of New York. So special needs plans. A special need plan is, it's a Medicare Advantage plan, and it's geared towards people that have a chronic condition, mentioned that earlier, institutional, so someone that's in an institution, or dual eligible. Now, as an independent agent, we are able to sell dual eligible plans. Those are for people that are on Medicare and Medicaid. We're not able to sell the chronic condition or the institutional. Not to say that they're not available, but if somebody wants one of those plans, they have to contact the insurance company directly. But we can work with people that are dually eligible. Okay, so chronic condition, again, they're special needs plans that are restricted to people with certain conditions, and it can be diabetes or heart failure or cancer. Someone has to have that condition to apply and to have that type of plan. And then dual eligible, which again, are for people that have Medicare and Medicaid. Okay. United Healthcare locally has a really popular dual eligible plan, but that's not the only company. There are others that have dual plans. Institutional special needs plans, they restrict enrollment to Medicare Advantage eligible people who for 90 days or longer have had or expected to need services from a long-term care facility, skilled nursing, long-term care nursing facility, immediate care. So it's 90 days that someone is expected to be in the facility, then they qualify for an institutional special needs plans. Okay. And then, they mentioned earlier the other kind of institutional equivalent special needs plans. They enroll Medicare eligible people who live in the community, but they do require an institutional level of care. So they're not in, one of the facilities that we talked about above, but, it could be an assisted living facility, for example. So private fee for service plans. I know that I mentioned last week that, there are certain plans that I'm going to talk briefly about. I'm not aware of any locally, definitely don't work with any of these plans, but I do think it's important, if you do live somewhere that and you do have access to these plans, it's good to know what they are, the details, in case you run across somebody that has one. So a private fee for service plan, what you really need to know about those is there are terms and conditions. So say that you want to go to a specific doctor. The doctor, you let them know that you have a private fee for service plan. They're going to look at the terms and conditions of the plan and decide if they're willing to treat you. if they treat you today for a specific reason, doesn't necessarily mean that they're going to treat you next week for a different, different treatment. So it's on a case-by-case basis, need-by-need basis as to if they'll treat you. And it's basically what it comes down to is if they agree to what they're going to get paid based on the terms and conditions in the plan. Okay. Some private fee-for-service plans have a network, some don't. And then, like I said, the enrollee, the beneficiary, has to let the doctor know before they receive the services that they have this type of plan, so that the doctor can decide if the non-network doctor can decide if they're going to want to treat you. With a private fee-for-service plan, the provider isn't able to charge more than what's in the terms and conditions. And that's going to be whatever's listed as the cost sharing in the plan. It may include balance billing of up to 15%, but only if that's allowed in the terms and conditions of the plan. Okay, they're going to have a maximum out-of-pocket limit for network and non-network providers, and they may have drug coverage, but they don't have to. Okay, so again, kind of a brief overview. I do think it's important that you know what that kind of plan is, but really don't get too involved in them. And then a Medicare savings account, again, I'm not familiar with any of these locally, but it's good to know what they are. So a Medicare medical savings account, it's a high deductible plan, and it's combined with a savings account. And Medicare contributes to the savings account. So basically how it works is there's a high deductible, and then there's the savings account. So the person pays out of the savings account and out of pocket until they reach the deductible, and then the benefits kick in. Okay. In 2021, the maximum deductible for an MSA was $14,150. Again, it can be less than that. So, the person uses what's in that account, pays out of pocket until they've paid the deductible, and then 100% is paid for covered services. And again, I'm not aware of any that are available locally. There may be. I just don't, we don't work with any of them. So with an MSA plan, the person is able to go to any Medicare approved provider. They may or may not have a network. All non-network providers have to accept the same amount that Medicare would pay as payment in full. Okay, and this is saying that they're available in all 50 states and the District of Columbia. So employer and union plans, it's a little bit different than the individual plans that we work with. Basically how it works with an employer union plan, employers and unions can offer retirees and the retirees' dependents different types of Medicare Advantage plans. It can be the individual plans that we work with. It can be a plan that's only available to these individuals. And then it can be a plan through a direct contract between the employer union and CMS, so a direct contract plan. Now remember, if somebody is still working, they are past 65, there's that 20 employee question that's really important to ask. Less than 20 employees, and it's not 20 people on Medicare, it's 20 employees. Less than 20 employees, Medicare is going to pay first. So the person absolutely has to sign up for Medicare. If there are more than 20, then there's going to be a few more options available to that person. So who's eligible for a Medicare Advantage plan? To be eligible, the person has to be entitled to A and enrolled in B. No, I mentioned this last week. That's misleading how that's worded, because for someone to have a Medicare Advantage plan, they have to have both A and B of Medicare. So yeah, entitled, but also you have to have A and B. You have to live in the plan's service area, or be a U.S. citizen or lawfully present in the U.S. on or before the effective date. So that would be 5 years previous. And then there are some plans that have additional eligibility requirements. So for example, special needs plans, we talked about the chronic condition plans. The person has to have that chronic condition in order to be eligible. The dual eligible plans, they have to have Medicare and Medicaid. Okay. And then in general, the person's going to have to continue to pay Part B. And I say in general, there are some situations where an employer or prior employer will pay for Part B, but most people have to pay for B themselves. Now, there's no underwriting or anything for Medicare Advantage plans. So health status really doesn't matter. If somebody wants an MA plan and they can enroll in one, they just enroll and pay whatever premium is required, and then they have their MA plan. Now, prior to 2021, people that had and have end-stage renal disease weren't able to have a Medicare Advantage plan. They had to, if you remember, we talked about ALS and end-stage renal disease. But with end-stage renal disease, they weren't able to have a Medicare Advantage plan. But at the start of 2021, that opened up to people that have end-stage renal disease. And then, certain, like I said, special needs plans or chronic condition plans, they can limit enrollment to people that have those certain conditions. Let's see. So yeah, this is basically the same, just saying that with a special needs plan, if it's an institutional plan, the person has to reside in the institution or live in the community, but require that level of care. Special needs plans that are for chronic conditions, they have to have that chronic condition. So employer group waiver plans or employer union plans can only enroll people who are active employees or retirees of the employer or union offering the plan. Okay, so, there's a specific company plan that's offered to retirees. It's only open to people that are retirees, or it could be, maybe a spouse, dependent, that type of thing. So we talked about a Medicare medical savings plan, and this is a list of people that are not eligible to enroll in a savings plan, savings account. Someone that receives health benefits that cover all or part of the deductible under the plan. That could be, primary health care coverage other than Medicare, Medicare hospice, certain supplemental plans, and retirement health benefits. People that are enrolled in a federal employee health plan, dual eligibles that are entitled to coverage of Medicare cost sharing under Medicaid, someone that's elected hospice. So there are some people that are not eligible to enroll in an MSA. So dual eligible, again, these are the special needs plans that we are able to offer our clients. You know, I think I said during the first module that I hear sometimes from people, agents that work with higher income clients, and they say, well, I'm not going to take the dual certification because I'm not going to, you know, I doubt I'm going to come in contact with somebody that's dually eligible. And then I, you know, frequently will get a call from them saying, you know, I'm going to have to quickly certify for dual eligibles because I just had somebody give me a call and they have both Medicare and Medicaid. So, you know, don't assume that you're not going to come across people that are dually eligible. And there are different levels of Medicaid. Now, truthfully, I don't get into this too much. If you come across somebody that's dually eligible, we're able to call. There's a phone number we can call. I know United Healthcare has on their website on Jarvis, they have a link that you can see. You can put someone's information in and it'll let you know if they're dually eligible. But just kind of, you know, for your own information, know that there are generally 4 categories of Medicaid programs that help people pay for premiums or cost sharing, Medicare savings programs. Okay. You know, qualified Medicare beneficiaries, QMBs. Again, you know, I personally, I feel like there's so much to know in Medicare, and this is really not something besides knowing that there are different levels of you know, Medicaid, qualified Medicare beneficiaries. You know, this isn't something that I really feel the need to memorize, but QMB only, those are people that just receive assistance paying for premiums and cost sharings. QMB plus, they're eligible for full Medicaid. And then there are special rules that apply to QMBs. You know, depending on what plan they're in, specifically what they will have to pay. And then, so dual eligible beneficiaries can enroll in any type of MA plan except an MA MSA. Like I mentioned, United Healthcare, for example, has a dual plan that is a 0 premium plan, and it can open up additional benefits beyond what someone would have in Medicare and Medicaid. They're really great plans if somebody qualifies. So Medicare Advantage plan and prescription drugs. So as I mentioned, most Medicare Advantage plans have drug coverage included. So an MA PD, that's the PD part, Medicare Advantage prescription drug. There are some that are just Medicare Advantage plans, don't have drug coverage, but you know, the MAPDs are I would say what we're most involved in. There has to be at least one MA plan with drug coverage in every service area. So, you know, the different companies, United Healthcare, Humana, they have to have at least one MA plan with drug coverage, one MAPD in every service area. MA private fee-for-service plans can offer drug coverage. They don't have to. And then MSA plans, they do not have drug coverage. If somebody has an MSA plan, they want drug coverage, they need drug coverage, they're going to be looking at a standalone drug plan. So if somebody enrolls in an MAPD, so there's drug coverage included, that's how they're going to get their prescription drugs. So it's not a situation where someone can have an MAPD and then say they're not crazy about the formulary in their plan and they apply for a separate drug plan. You can't do that. So an MAPD, you know, we need to make sure before they sign up that their prescription drug list is in the formulary and hopefully in the lower tiers. So cost plans, again, this is kind of like the MSA and the private fee for service. Don't really, I'm not aware of any locally, but it's good that you are aware of what they are. They're not considered Medicare Advantage plans. They're not considered original Medicare, which remember is just Part A and Part B. Many have drug coverage. They're not required to. There can be additional supplemental benefits. They're only in certain parts of the country. And then somebody can enroll in a cost plan and a prescription drug plan. So how do these plans work? If somebody has a cost plan, there are two ways that they can receive a benefit. If they go to network providers, then the plan's benefit's going to kick in. If they go to an out-of-network provider, then original Medicare is going to kick in. Okay, so in network, it's going to be the cost plan benefit. Out of network, then you're going to be looking at original Medicare. So who can enroll in a cost plan? People that have A and B, or someone that only has B. If somebody only has B, they're not going to have A coverage under the plan. Unless they purchase it, there'll be an additional cost. And then they'll have to pay their Part B premium still, and any plan premium that goes with the cost plan. So I know last week, first module, we talked briefly about appeals and grievances, and this is going to go into a little bit greater detail. These are the enrollee protections. So the rights of an enrollee or a beneficiary of a Medicare Advantage plan, they have the right to file complaints, which are grievances, and they can be complaints about the quality of their care. They have the right to get a decision about if their health care is going to be paid for, or what they're going to be paying for prescription drug coverage. And then they also have the right for an appeal. They can appeal certain decisions about healthcare payment, if something is covered, or prescription drugs. And again, if maybe there's a prescription drug that isn't in the formulary, your doctor is saying you definitely need to take this drug, nothing else is going to work for you, then that's definitely a situation that an appeal would be looked at, and you would want to get your doctor involved in that. And I always say, I mean, I definitely think that there's a purpose of appeals, and a lot of time I've seen frequently that they're approved. So complaints, coverage decisions, appeals, again, concerns or disagreements with their plans, that's going to be the grievance, file a grievance or complaint, and then an appeal. It's to ask for a review of the plan's coverage or payment decisions, which, like I said, I've seen some positive results of appeals. Grievances. Someone can file a grievance if they're just not happy with the service that they're getting. Timeliness. You call to make an appointment, you're sick, and the earliest that the doctor's office can get you in is 2 months from now. Great reason to file a grievance. But it can be, access to a service. There's a number of reasons that someone would want to file a grievance. And then there's going to be instructions as to how this is done. It can be on the CMS website. There would be instructions in their evidence of coverage, I would think, or they can call the number on the back of their card and ask. But they're given instructions as to how somebody can file a grievance or an appeal. And then coverage decisions. So they're made by the health plan, and it's concerning whether a prescription drug is covered, how they're covered, and what the company is going to pay. And it can also, besides a prescription drug, can be the medical care. So, prior authorization. If somebody needs prior authorization to furnish a service, payments for certain items or services, if the doctor is saying, yeah, you really need this, and the insurance company, the Medicare Advantage company, is refusing to pay, then that's an appeal, or that's a coverage decision. Obtaining payment for services when somebody is temporarily out of the area, to continue a service. So I know we talked briefly about if somebody's in the hospital, the plan is saying we're only going to cover this many days, but and the doctor knows that you need more than that. That's something to look at with the insurance company. And then to obtain payment for a prescription drug, to ask for an exception from the formulary. So if there's a specific drug, again, that the doctor is saying the enrollee or the beneficiary needs to take, the company is refusing to pay for it, that is where an exception would come into play. And then appeals. Someone basically is just not happy with a decision. Can be if something is going to get paid, basically number of days that they're allowed in a hospital, number of things. If something in general should be covered and they're being told it's not going to, then that's where an appeal comes into play. Again, the person is going to have a description of the appeal process. There can be a time frame as to, I believe it's the grievance that's 120 days, but there's going to be a time frame as to when somebody can file the appeal. They can call the number on the back of their cards for instructions, but they should have received them. Okay. That could be a secure website. It can be a secure email. So just know that there is an appeal process. So other enrollee rights. Enrollees of a plan have a right to select or change their doctor. Network restrictions can apply. So say somebody is going to an in-network doctor, they want to switch to another doctor, come to find out that other doctor is not in network. That can be an issue. They have to have access to doctors, specialists, and hospitals, and access to emergency care when and where they need it. And remember, emergency care, urgent care, people aren't going to worry about networks. You go to the closest one, and there's a benefit for it. Enrollees of a plan that has Part D benefits, they have to have access to the Part D drugs through network pharmacies, retail specialty and home infusion pharmacies, convenient access to long-term care pharmacies if the person is in a long-term care facility. So there has to be, easy access to the Part D drugs. And then other enrollee rights: be protected from discrimination, understand their condition and what treatment choices are available, and participate in treatment decisions. Know how their doctors are paid. People don't usually think about that, but it's a right to know how someone's doctor is paid. And then have personal and health information kept private, HIPAA, and then obtain a treatment plan. And I have to add to that, obtain a treatment plan that is understandable. So the last screen, I know that I had this up in the first module, but I thought I would leave it in this one. It's just some, different resources for additional information. There's the cms.gov website. There's the Medicare and You handbook. It's the annual handbook. It's got some great information, and Medicare.gov. Beyond the Medicare and You handbook. So this is the end of Module 2. Again, tons of information in a short period of time. If something is unclear, confusing, please let me know. My name again is Janine. My phone number is 585-271-6400, extension 101, or my email, janine@kafl.com. Janine is spelled JEANINE@KAFL.com. But just let me know if something's confusing, and hopefully I'll be able to explain it in greater detail. So thank you. Next is Module 3.